From the examination room to the upper echelons of Africa's healthcare circles, Dr. Frasia Karua has arguably one of the most diverse skill sets of any Kenyan doctor you'll meet. She's had the privilege of working across the healthcare value chain from the pharmaceutical industry, health insurance, consultancy, and clinical services. It is because of this that she is on the cusp of one of her biggest career moves yet. We sat down with Dr. Karua to reflect on her journey so far and talk about her vision that will see universal healthcare become a reality in Kenya. Frasia Karua had a typical Kenyan upbringing, going to good schools and working hard to make something of herself. Her journey to her incredible success in the healthcare industry, however, has been anything but typical and began with a personal encounter when she was a little girl.
My grandmother was living with diabetes and she would spend a lot of time at our place. So I started getting involved in her care. And, she taught me, for example, how to, draw the insulin from the cartridge, how to, inject her, how to measure her sugar levels. So over time, I started, getting attracted to that, caring for someone who's in need.
Her experience in medical school and subsequently interning in various medical institutions spurred Frasia to go beyond waiting for patients to seek her services and instead participate in strengthening the health system.
Children especially, would die out of causes that would be preventable if only the mother knew what to do in good time or if they had the information in good time. So I worked for Gertrude's and I got into the program side, and so I coordinated the clinical programs within the hospital, and that really was about going to the community, actually delivering services there, and also educating mothers and the families about the children's health.
Frasia would eventually move into other parts of the healthcare value chain, first by working in the health insurance space and seeing why so many Kenyans were not covered because of access. Then entering the pharmaceutical industry and witnessing firsthand the factors that would make drug costs so out of reach for many patients.
Sometimes when you're in the clinic, you just write a prescription. It doesn't occur to you the cost that the patient would incur. And so within the pharmaceutical company, you understand also their side that to produce these medicines, it takes an investment. So how do you ensure that you create, an environment that everyone wins? That gave me a good experience to then move to Amref Health Africa, where I was recruited to establish a social enterprise that would bring the private sector practices into an NGO.
Throughout her career, Frasia would often have to contend with being the youngest manager or director in an organization and the gender stereotypes that come with being a woman in leadership. Having more women in leadership roles, especially in the health sector, Frasia believes will make her presence less of an anomaly.
We need to encourage more women to become hospital, managers, clinic managers, chair ladies of health committees. So I think there's still more we can do, and we need to encourage women and create that space. And you talk about gender transformative leadership, which brings everyone in the society to actually play a role in enhancing gender roles within the different sectors.
Frasia's goal goes beyond climbing the corporate ladder even higher and extends to seeing the vision of universal healthcare become a reality.
You must ensure that the community member or the individuals own their own health and understand what that means. And so once, for example, you make people aware of what health is to them, it's a key area that they need to invest in, both from a prevention point of view as well as a curative when they need to seek care.
She believes that this is the first step to ensuring more Kenyans have a fighting chance when it comes to their health. Frasia continues to work in educating the masses, networking with industry players, and changing the system one program at a time in hopes that Kenya's health sector will transform for the better.